Welcome, everyone, to the Tary Podcast. This is Season 1, Episode 5, called Strategic Plan for Primary Healthcare Center.
Glad to be here.
This discussion today comes to you from the Tary Quality Team.
Yeah, that's right.
And today, we're diving into the strategic plans for a primary healthcare center. We've got a couple of documents here that lay out their goals, their objectives.
Yeah, how they plan to serve the community.
Exactly. Over a 5-year period, one plan covers 2017 to 2021, and the other uses the Islamic calendar 1438 AH to 1442 AH.
Which lines up pretty closely, doesn't it? Roughly 2016-17 to 2021.
Right. So our goal today is really to get under the skin of these plans, figure out the core priorities.
Understand the strategies they put in place.
Yeah, to boost community health and well-being. We'll look at their ambitions, the challenges they saw.
And, the path they laid out for a thriving primary care environment.
And just for context, Tary is a medical health tech company. We're committed to improving healthcare access and quality.
Okay, so let's dig in. Looking at these plans, the main goal really stands out, doesn't it?
It does. Seems pretty consistent across both.
Yeah, both documents really emphasize this core aim, providing, and they use the words adequate and appropriate services.
And that's not just treatment, right?
No, exactly. It's preventative care, it's curative, health promoting, even rehabilitative services.
Wow, that's broad.
It is. The big picture here is ensuring, mental, psychological, and physical well-being.
So people can contribute more to the country.
That seems to be the idea. Economic and social growth. It's quite comprehensive, ambitious, really.
Absolutely. It's not just like fixing problems after they happen. It's more proactive, nurturing health.
Building from the ground up.
So these big aims then break down into key strategic objectives. Looks like maybe 6 main areas.
Exactly. 6 areas that kind of act as the roadmap for achieving that main goal we just talked about.
Okay, what's the first one?
The first is all about reducing the burden of disease and improving quality of life overall.
How do they plan to do that?
Through comprehensive primary healthcare services designed for, well, everyone, all age groups.
That sounds like a massive task. Reducing the burden of disease. What specifically are they looking at there?
Well, for non-communicable diseases,
the
chronic stuff.
Like diabetes, high blood pressure?
Exactly. Diabetes, hypertension, obesity, asthma. They've got this sort of two-pronged approach.
Okay.
Prevention and management. So preventing them, yes, but also surveillance, treatment when they happen, and rehabilitation.
And are there specific goals within that?
Yeah, things like improving the quality of care itself, like monitoring blood sugar, blood pressure, cholesterol properly.
Consistent checkups.
Right, which helps catch problems early, adjust treatment. They also want better early detection generally and to reduce risk factors.
Like obesity and smoking.
Yep, within the area they serve. It's that shift towards prevention you see everywhere now.
Makes sense. It saves money and improves lives long term.
Definitely. But success depends on good public health campaigns, things that are accessible and culturally sensitive.
And how will they know if it's working? How do they measure this?
They'll be tracking several performance indicators. Things like how common these diseases are, mortality rates associated with them,
Better.
the percentage of patients whose conditions are well managed based on guidelines.
Right. Under control.
And how often complications occur. It's very data focused.
Good. You need the numbers. What about communicable diseases? That's a different beast altogether.
It is. For infectious diseases and environmental health, they have a specific target. Cut new infections by 10% a year.
Ambitious.
Yeah. And ensure early detection, proper management when infections do happen, stop the spread.
And the environmental part.
They want to boost community health by improving the environment inside the center, hygiene, infection control.
Standard stuff.
And also external factors, things like sanitation, maybe water quality in the community, broader public health.
How do they measure that success?
By infection rates across different groups and how well they actually manage the cases they find. Are they following the right protocols? Timely diagnosis, treatment, contact tracing if needed.
Okay. The plan also mentions maternal and reproductive health. What's the focus there?
The main goal is providing integrated, comprehensive services for women during their reproductive years.
So like from before marriage onwards?
Yeah, pre-marriage, pre-pregnancy, during pregnancy, childbirth, and then the postpartum period too. All aimed at safe, healthy outcomes for mom and baby.
What kind of care does that actually involve?
Well, the plan doesn't list every service, but it stresses continuity. So Think pre-pregnancy advice, regular checkups, skilled birth attendants.
Post-birth support.
Exactly. And they'll track if they're providing care across all those stages, how well they handle complications, referral rates to specialists.
And the really serious outcomes.
Yes, crucially, morbidity and mortality. How often women get sick or sadly die from pregnancy-related causes. Tracking that helps them improve. Pinpoint where things need to get better.
Very important. Okay, moving to child health. That must cover a lot.
It does. The plan kind of splits it.
Yeah.
There's general healthy child care from before conception through development stages.
Okay.
And then a specific focus on improving nutrition, especially for kids under 5.
And the goals there?
Providing comprehensive services, monitoring growth, early detection of any issues, boosting breastfeeding rates.
Which we know is really beneficial.
Hugely. And tackling malnutrition head on. It's about building that healthy foundation for the future.
Vital work. How do they measure success with kids?
They look at coverage. What percentage of kids are using the services? Are they tracking growth milestones consistently?
Identifying kids at risk?
Exactly. How many at-risk cases are caught early? Referral rates? And again, overall illness and death rates among children.
Plus the breastfeeding and malnutrition stats specifically.
Yep. Gives them a clear picture of what's working and what's not.
The plan also singles out elderly health. That's a growing area of need globally.
Absolutely. The goal is promoting health for people aged 60 plus. Again, integrated services treatment, prevention, rehab.
And making it easy for them to access.
Yes, facilitating access is key. And also encouraging them to stay active and engaged in the community.
What are the key metrics for elderly care?
They'll track the prevalence of common diseases in that age group, how well they detect physical disabilities.
Things affecting independence.
Right. Mortality rates, of course, and even social issues like isolation. They might also look at lifespan, use of specific services like mental health or dental care for seniors.
Okay, and the last piece under this reducing disease burden objective is health promotion and awareness, the proactive part.
Exactly. Empowering people and the community. Better health literacy, basically.
So understanding health factors.
Yeah, understanding influences on health, how to manage conditions, and crucially, how to prevent illness in the first place through targeted programs.
How on earth do you measure improved health literacy? That sounds tricky.
It is a bit abstract, but they'll look at implementation. Are the programs actually running? Are there visible shifts in lifestyle choices?
More exercise, healthier eating.
Things like that. Changes in illness rates overall. And trying to gauge understanding, maybe through surveys or community feedback.
Okay, so that first big objective covers a lot about tackling diseases, promoting health across the lifespan. The second objective shifts to access, making sure people can actually get the care.
Right. Facilitating access to comprehensive services. It's about making sure the services fit the community's needs and are easy to use.
What does that involve?
Several things. First, service development, adapting what they offer to match what the community actually needs.
Makes sense.
And also looking at the center itself. The internal environment, the building design, making it better for staff and patients.
Thinking about the whole experience.
Exactly. Then there's a big focus on infrastructure and the work environment.
Like?
Extending consultation times. That helps people with tricky schedules. Increasing staffing levels so they're not overwhelmed.
Basic resources.
Absolutely. Having the right medical equipment, reliable supplies of essential drugs, practical stuff that makes a huge difference.
Totally. A great plan means nothing without the tools. What about specific service developments?
Yes, they mentioned developing basic dental services, treatment, and prevention. That's often a gap in primary care access.
True.
And strengthening support services like the lab and radiology. More diagnostics on site.
Keeping care local.
Right. And again, just ensuring essential medicines and supplies are consistently available. That's fundamental.
How will they track success in improving access? What are they looking at?
They'll assess the physical environment. Is it suitable? Enough space? Accessible for everyone?
Safety standards, too.
Yes, are safety standards in place for staff and patients? And monitoring overcrowding. Is it efficient? Comfortable?
So if people can get care easily, safely, comfortably, that's improved access.
Pretty much sums it up.
Okay. Objective 3 moves to the quality system, developing and enhancing it. That feels like the foundation.
It really is. This is about making sure the care is high standard, implementing and strengthening quality systems everywhere in the center.
What does that look like in practice?
Big emphasis on patient safety, updating clinical guidelines based on the latest evidence, best practices national, even international.
And protecting rights.
Yes, clearly defining and upholding the rights of both providers and patients. Building that trust.
Building a culture of quality.
Exactly. And reinforcing supervision, monitoring, evaluation, making sure standards are actually being met day to day.
So the goal is better staff performance, better infrastructure,
leading to patient-centered care that meets those high benchmarks, and ultimately making everyone happier staff and users.
How do they strengthen those supervision and evaluation programs?
They mentioned using both internal assessments, looking at their own data and practices, and external ones.
Like accreditation bodies.
Potentially, yes. Or other independent reviews against standards. Gives them a rounded view of performance, helps find where to improve. Regular feedback loops are key too. Got it. Objective 4. Strengthening partnerships and coordination. Healthcare isn't done in a vacuum.
Definitely not. Collaboration is crucial. One key area is better coordination between the primary center and referral hospital.
Or specialist care.
Right, making that transition smooth for patients. No communication gaps, no delays.
Makes perfect sense. What other partnerships?
They want to collaborate more with other health bodies and also civil society organizations, community groups.
Why?
To deliver a broader range of services, maybe reach different groups, and just better meet the community's diverse needs. Building trust with partners is also a priority.
And involving the community directly.
Yes, that's highlighted too. Getting the community involved in planning, delivering, and evaluating services.
So the services are relevant and have buy-in.
Precisely. Makes them more effective.
Okay, Objective 5. Improving decision-making and planning. The structure behind it all.
It really is the underpinning framework. Part of this is developing clear organizational structures for departments, for the whole center.
How do they do that? Interestingly, the 1438-1442 plan mentions involving department heads in creating these structures. So a bottom-up element.
That's good. People doing the work know what's needed. What else helps decision-making?
A huge piece is establishing a comprehensive electronic health information system, EHR.
Moving digital.
Yep. Giving all staff easy access to clear, accurate health info. Essential for good patient care decisions, resource allocation.
Planning future services based on real data.
Exactly. And the plan also touches on governance, strengthening leadership in primary care. Good leaders drive change.
Okay, the final objective, number 6. Enhancing staff efficiency and skills.
Oh.
Comes down to the people.
It always does. You need a skilled, motivated workforce. So this involves developing targeted training programs for all staff.
Keeping skills sharp.
Right. Making sure they have the latest knowledge.
What else is in this objective?
Improving satisfaction for both the providers and the patients.
How?
One specific mention is enhancing communication skills between staff and users. Clear, empathetic communication is vital for the patient experience.
Absolutely.
And finally, fostering continuous professional development, helping staff keep up with best practices, supporting their growth, encouraging innovation.
So those are the 6 big objectives. They've also thought about tracking progress, right? Evaluation.
Yes, that accountability piece is built in. Ongoing monitoring at different levels. Department heads do field follow-ups, oversee implementation.
Keep things on track day to day.
Right. And they submit regular progress reports every 4 and 6 months.
Who looks at the big picture?
The center director and the quality program coordinator evaluate performance indicators across all departments twice a year.
A holistic view.
Yes. See how the whole center is doing against the goals, identify challenges, successes.
And the plan itself gets reviewed.
The original plan from 1437 AH was set up for annual review over the 5 years. Department heads create yearly action plans aligned with the strategy, keeps it dynamic, relevant, allows for adjustments.
It's interesting how themes keep repeating. Patient focus, quality, workforce, they all tie together.
They really do. You see strong themes. Patient-centered care is clear in the focus on quality, access, satisfaction. Comprehensive integrated care aligns with broader health strategies. Quality improvement is everywhere. Accreditation, evaluation.
Workforce development is big too.
Huge. Training, satisfaction, growth, and community engagement partnerships involving residents.
And data-driving decisions.
Yes, the push for that electronic health system.
Yeah.
And underlying it all is accessibility and equity, trying to serve everyone.
This has been really useful, unpacking the strategy for the Almoda Primary Healthcare Center. A lot of thought clearly went into this roadmap.
Quite detailed.
For listeners wanting to dig deeper, the link to the document itself is in the description.
Worth a look if you're interested in the specifics.
And you can always learn more about how Tary, as a medical health tech company, supports healthcare advancement on our website, tary.care.
You know, what strikes me is that level of detail. Specific targets for chronic diseases, clear plans for staff skills, community engagement. It really shows how complex primary healthcare is.
It really does. So many different facets to improving a whole community's well-being.
Makes you appreciate the challenge.
Definitely. It raises questions too, doesn't it? What aspects stood out most to you listening? What more might you want to know about how this gets put into practice on the ground?
Yeah, the implementation and the real-world impact. That's always the next question.
Exactly. It's
Yeah.
a bigger conversation for sure. We definitely encourage people to check out the documents and keep thinking about these crucial issues.